Okay, we have kind of an interesting slide here. So what we're looking at is a neutrophil, and it is a band neutrophil. I would not call this a segmented neutrophil because although it is going in the direction of being segmented, there hasn't that's the nucleus has not quite pinched. Therefore, I would call this a band. What else? Really, the focus of this particular cell is the fact that it has vacuoles in it. So vacuoles are something that we see in neutrophils when usually it's when there's some kind of bacterial infection going on. And in that situation, more neutrophils are probably going to be produced and they're going to be moved out of the bone marrow maybe a little bit faster than they normally would. And how we can see that is because overall, first of all, over on this slide, there's a left shift, meaning that there are more immature forms of neutrophils, specifically with the bands. You can also say that this cell, this neutrophil, is slightly larger than a normal segmented neutrophil. Another thing that we can see in this neutrophil is a little bit of toxic granulation. So that also is kind of a signal that this is an immature cell, and the overarching situation may in fact be a bacterial infection because we have a left shift, we have a little bit of toxic granulation, and we have vacuoles. Now, what else is kind of interesting about this slide, if you look at the red cells, like about 5 o'clock and 8 o'clock, we see some basophilic stippling. And then if we move it over here a little bit, we can see a little bit more basophilic stippling going on here.